So my name is Roselle de Guzman. I'm a medical oncologist in Manila Central University Hospital in the Philippines. So what I talked about in the plenary session today is the relationship between indoor air pollution and lung cancer risks. So not so many people are aware that indoor air pollutants, like those coming from cooking oil fumes, the use of wood burning in fireplaces and stoves, as well as radon gas and asbestos, these are all risk factors for developing lung cancer. And it depends on the exposure. It's still not very clear as to how much exposure is needed for one to develop lung cancer, but we know that there are evidences, the data are there, that these are indeed risk factors. Also, including secondhand smoke, there's still a great burden of disease secondary to secondhand smoke, which is one of the major causes of lung cancer in never smokers. And we know that the one of the risk factors, especially for um, lung adenocarcinoma, especially the high incidence in East Asia, could be related to exposure to cooking oil fumes, because the traditional setup in cooking methods and the kitchen setup in most of the rural areas in low and middle income countries are not very well ventilated, and the use of solid fuels such as coal, charcoal, biomass, and wood uh, gives a lot of pollutants in the air, and that increased the lack of ventilation, increased the indoor pollution. So another interesting, although this is still a very uh, uh, new smoke exposure, is what we call the third-hand smoke. Not much information yet as to how this affect human health, but there have been early studies on experimental animals that when they are exposed to third-hand smoke, they develop lung adenocarcinoma later on. And this third-hand smoke is the residual smoke that is left in the air and then get absorbed in indoor surfaces, and then later on they are emitted into the atmosphere, and that's how it may be a risk factor also, but still very early to tell, not much evidence on that. Another thing that I talked about in the plenary session is on um, the radon gas, which is something that we're not really very aware. It could be present inside our homes and we could be breathing in on a daily basis, but we're not very aware. And but it's important because it's a risk factor for lung cancer. And most of it ranked as the second most common cause of lung cancer among people who smoke, and also a significant cause of lung cancer for those people who never smoke. So, as well as asbestos is also an important risk factor. And I just get this opportunity to thank WCLC for highlighting these issues in the session. So I learned also a lot from the other speakers who talked about um, the issue on climate change and how that impacts lung cancer. So there are so many things that we learned today from the session. Well, specifically for indoor air pollution, there's a lot to do. It's not only an oncology issue, it's a public health issue. So we need more um, collaboration with the other stakeholders So to start off, maybe for oncology professionals, is to educate ourselves to be more aware that these are important risk factors for lung cancer. We as healthcare professionals are trusted advocates, and people and patients listen to us. So we have to make sure that we give them the proper advice and what they could do inside their homes as much as possible. What are the factors or the things that they can do to mitigate and hopefully eliminate uh, these risk factors as much as possible. It's really a significant problem because people are not really aware that they may be already be exposed to indoor pollution without them knowing. And in fact, almost 3 billion people in the world are exposed to this indoor pollution from wood burning, from radon, from all these pollutants. And these are proven to be all those pollutants are proven to be, most of these are proven to be carcinogenic or genotoxic or mutagenic. So these are environmental factors. We're not really in a typical clinic when we do history taking and see patients, we don't typically include environmental exposures. Majority, perhaps, of clinicians do not include environmental exposures as part of the history taking. So um, I think we have to really work more on that and how to uh, be able to get those risk factors as relevant information from our patients. We do have low dose CT scan as screening for patients who smoke and considered high risk, but we do not have yet these environmental factors to be included in the screening, in the risk prediction model for lung cancer screening. There are groups working on this, and hopefully we'll be able to have those integrated into the screening programs. We remain to be optimistic about that because we will be missing out maybe half of those patients. Screening them early, we will be missing those um, without to have their cancers detected at an early stage if they're not included in the screening program, which is understandable. There's a lot of barriers to that and challenges in doing these risk prediction models for lung cancer screening.